Thank you, Kathy. The time now is 9 minutes past 7. Should the NHS in England spend more than £110 million a year on prescriptions for medicines, for upset tummies, for hemorrhoids, for travel sickness and indigestion, which can actually be bought cheaper over the counter, and a further 20 million or so on gluten-free food, which can be found at your local supermarket? That is the question raised by the head of the NHS in England, Simon Stevens, in a week when he'll be unveiling a review of his 5-year plan for the health service. We'll be talking to him on Friday. Now, Mr Stevens is responding to pressure from local health commissioners. Dr Amanda Doyle amongst them, a GP in Blackpool and co-chair of a national body called NHS Clinical Commissioners, and the chair of another body, the Royal College of GPs, is Professor Helen Stokes-Lampard. Good morning to you both.
Good morning.
Dr Doyle, why do you think it might be right to start or to stop spending money on these sorts of medications?
Because we're having to make quite difficult decisions at the moment. The NHS is in quite constrained financial circumstances, and what we're trying to do is prioritise our spend. So we're currently spending hundreds of millions of pounds on things that we would generally consider to be low priority for funding, and we're looking at ways of reducing that spending so we can direct the funding into things that take a higher priority.
But if you're somebody who's a celiac, who needs gluten-free food, in other words, not to have a terrible reaction, even if you can buy food relatively cheaply at a supermarket, you would still argue, if you were poor, wouldn't you, that this was an unfair burden on you. The health service should look after you. If you're in pain and you needed to go and buy a lot of painkillers, wouldn't you think the NHS should provide those for you?
Well, they're two separate issues. In an ideal world, we would, but finances are difficult. Gluten-free food was introduced on prescription in the 1950s when it was really difficult to obtain. Now, it's a...
Oh, we just lost the line. Let's bring in Professor Helen Stokes-Lampard while we get your line sorted out. The many GPs I know are saying it's time the NHS was honest about what it could and could not afford. Do you welcome this, therefore?
Yes, we do welcome these proposals, but cautiously. A lot of this that's been announced, or that Simon has been reported talking about, will be announced later this week, is about standardising good practice that already exists. So that's for some products that there really isn't any evidence that they work. But for some things like celiac disease question, this is much more about us doing a consultation about what we should do next. My understanding is this is not going to be a blanket ban on products, and I think a blanket ban might well introduce some unfair problems. So we need to tease it all out before we just introduce it. However, and Amanda is absolutely right, that the world has moved on a lot from when these things were initially put on prescription. Yes, they are still more expensive than non-gluten-free products, and normal products, but they are readily available in every supermarket. So we are in a slightly different world, and it's good to have these difficult conversations.
We're in a world of rather bad lines, I'm afraid. Dr Doyle, let's see if yours is working a little bit better. Oh, we've lost her, I'm afraid. Well, Professor Lampard, you would encourage people, therefore, to accept, would you, that at a time when we do not have as much money as we might like in the NHS, we will have to stop providing certain things?
Yes, so take indigestion remedies or hemorrhoid creams at the moment. These are things that people frequently already buy without seeing a GP. They know what the problem is. They know they go and purchase them anyway. But then sometimes GPs are put under pressure to prescribe things, partly because somebody's in the room with you and asking you, well, this would really, really help you, and the patient just looks at you and says, well, can you prescribe it, doctor? And you say, I frequently say to patients, do you pay for your prescription? If you do, cheaper to buy these things over the counter than pay a prescription fee. The difficulty is when people don't pay prescription charges, so they're entitled to free medication on the NHS, and that's where difficult conversations will come in, and that's what's not clear yet, is what we'll be doing in those situations, and I think that's where the difficult conversations with doctors and patients will be. GPs don't want to be rationing, but we are the people who see the most patients. 1.3 people will see a GP today. 1.5 million prescriptions will be issued today. I think it is time that the country needs these difficult conversations, but we mustn't jeopardise or put at risk the health of the vulnerable.
Dr Doyle, why don't you have a conversation, some might ask, with the government, simply saying £100 million is not a vast sum of money, find it. Raise taxes if necessary, cut something else if necessary, spend what the NHS needs.
Well, because there are lots of calls on those £100 million, and so what we're trying to do is prioritise how much money we have available as a political decision. What we're trying to do is give the best health and care services we can for the money that's available, and some of the products that we are talking about being less of a priority are things that aren't going to have a huge impact on clinical outcomes, or, as Helen says, things that people commonly buy relatively cheaply over the counter anyway.
So GPs, in other words, as a final thought, Dr. Doyle, are going to have to bite their lip and sometimes say, no, you simply can't have this, we can't afford it.
For some things, we're going to have to do that, yes.
Dr. Amanda Doyle, Professor Helen Stokes-Lampard, apologies for the quality of the lines again. Thank you for joining us.